This is Brett of the Brookbush Institute, and in this video we're going over advanced self-administered release techniques, specifically biceps femoris, dynamic release, or pin and stretch. I'm going to have my friend Melissa come out. I'm going to kind of explain the setup. This is a bit of a tricky setup. If you guys have ever tried to do release techniques for the hamstrings sitting on the floor with your legs stretched out in front of you, you might have noticed it doesn't work very well. It's very hard to find any sort of tender point. It doesn't really seem to help extensibility all that much. If you get on a platform that you can sit on with your legs dangling, it actually makes things a lot easier because now we have a relaxed biceps femoris, and we can use the weight of your leg to create pressure rather than trying to sit up on the floor, which might even activate the biceps femoris and make a release very hard to get. The next thing we have to figure out is, you may have noticed that a foam roll doesn't work very well, that as soon as you put pressure with a foam roll, you just kind of flop either hamstring to either side of the femur, and it's really hard to get any sort of specific pressure. So we need a little smaller surface area so that we get more pressure per square inch. Now last, for this particular technique, is we need a smaller surface area to pin down the adhesive tissue in my biceps femoris, but I still need to maintain my perpendicular width so that I can block the adhesion as I'm going to have her move through this particular technique. That's where these massage therapy balls come in. They're very handy. They're foam 5-inch balls. I suppose you could use a medicine ball if you could find the right size ball, but for convenience, these trigger point balls are real nice. I'm going to have Melissa go ahead, and she's going to look for a tender point between her knee and her ischium on the outside of her thigh there. Just look for the most tender point. You can roll back and forth, kind of scoot on your butt, or you can move the ball as she is, or a combination of the two. When she finds an adhesive point, I'm now going to ask her to move just distal to it. That's closer to her knee. So she's going to move just like this. If this is the ball, this is the adhesion, right? We're going to move just off it, because what I want her to do with that ball is block the adhesive tissue. Because now I'm going to ask her to do the fun part. I'm going to ask her to extend her knee, which is going to lengthen my biceps femoris and pull those muscle fibers through the adhesive tissue, which we hope helps her extensibility. So she's going to block, extend her knee, hold for 2 to 5 seconds, and then back down. If somebody doesn't have this much extensibility, you could have them put their hands behind them and lean back a little bit, right? So we'll lengthen out the biceps femoris by extending at the hip a little bit. Hold. She's going to do 10 to 15 repetitions for 2 to 5 with 2 to 5 second holds at the end. The same sort of protocol you'd use for active stretching. If I needed her to do both sides, I could have her do 15 and 15, and then we're going to move on. As far as where this fits in our program, realize that these are progressions from static release techniques. I would like to start by toning down what overactivity she has in her biceps femoris, and probably a more effective way to do that is with those static trigger point releases. We need to make sure that we're using these techniques specific to improving movement. So I don't want anybody chasing pain just because their hamstrings hurt or because they feel like their hamstrings are tight. Remember that feelings aren't facts. We need to go back to our movement assessment. If I'm using this technique, I'm thinking somebody's feet turn out, their knees bow in, or their knees bow out. They have an inadequate forward lean or a posterior pelvic tilt on their overhead squat assessment. So those are those 5 signs. If I was looking at goniometry, I'd be looking at maybe my knee extension with hip flexed goniometry assessment, internal or external rotation of the hip, internal rotation being more, or a limit in internal rotation being more indicative of biceps femoris tightness. Muscle length tests, of course, we could do the hamstring length test if we were looking specifically for hamstring length. Big overarching concept there, guys, is this would be based on a movement assessment, and it would follow doing probably 2 to 6 weeks of static release techniques for the same muscle before I used this progression in some sort of home exercise program, integrated warm-up, movement prep sort of situation. So there you guys go. You're going to look for the most tender spot on the lateral back of the thigh, all right, the lateral portion of the posterior thigh. Once you find that adhesive point, you're going to go just distal to that point. Make sure that that adhesive tissue is now blocked behind this trigger point massage therapy ball. You're then going to extend the knee to pull that biceps femoris through that adhesive tissue for 10 to 15 repetitions with 2 to 5 second holds. I hope you guys get great results. I look forward to hearing about your outcomes.